Hi, I'm Dr. Leslie Odell. I'm an optometrist practicing as the medical director at Medical Optometry America and a current Cequa speaker for Sun Ophthalmics.
Hi, Dr. Odell. Thank you for joining us today. Can you tell us a little bit about the most notable side effects from the clinical studies?
This is a great question because while we always want to focus on efficacy, it's important to note the safety and potential for adverse events. While most adverse events were mild, the most common adverse events reported in greater than 5% of patients were installation site pain and conjunctival hyperemia. Most ocular adverse events reported by patients treated with Cequa were mild or moderate at 80% and 17% respectively. Additionally, discontinuation due to ocular events was also low, with 3.2% of Cequa patients reporting discontinuation versus 1.1% for the vehicle. In the phase 3 study, the majority of ocular adverse events in both treatment groups were mild in severity and did not require treatment. There were no serious ocular events reported. 6 patients in the Cequa group and 2 patients in the vehicle group reported adverse events of severe intensity. Severe ocular events reported were installation site pain for 2 patients and installation site hypersensitivity for 1 patient in the Cequa group. 1 subject in the vehicle group reported foreign body sensation in their eyes. Although installation site pain was reported with Cequa use in 24.2% of patients, the discontinuation rate was 4.6%.
So, what is it about the formulation of Cequa that sets it apart from other formulations of cyclosporine?
Cequa is unique because it features advanced proprietary NCELL technology that delivers cyclosporine in an innovative way for increased ocular penetration. Cyclosporine has proven anti-inflammatory power, and Cequa features the highest concentration of cyclosporine approved by the FDA.
Can you expand a little bit on NCELL Technology?
Cequa has advanced proprietary NCELL technology that uses nanomicelles composed of a polymer blend that self-assemble and work together to protect the cyclosporine. The secure hydrophobic core prevents the encapsulated cyclosporine from being released until after penetrating the aqueous layer of the tear film. The small nanomicelles are able to penetrate the aqueous layer of the tear film because they have a hydrophilic outer layer that allows for transport to the ocular surface. The nanomicelles then break up, releasing cyclosporine to penetrate the ocular tissues.
We've established that Cequa has an innovative delivery, but what was the primary endpoint in the Phase 3 pivotal study 2?
Phase 3 evaluated the safety and efficacy of Cequa in the treatment of dry eye disease. The treatment duration was 12 weeks, preceded by a 14-day vehicle run-in period. The primary endpoint for Cequa is that patients experienced clinically meaningful improvements in tear production. 16.6% of patients using Cequa had an increase of 10 millimeters or greater from baseline, while only 9.2% of those using the vehicle experienced the same increase. One thing to note is that the formulation of the vehicle was identical to the formulation of Cequa aside from the omission of cyclosporine. Because it can lubricate the ocular surface, the vehicle alone may have contributed to the overall improvement of symptoms. It is likely that the overall improvement of symptoms on Cequa is greater than what is apparent when compared to an effective vehicle.
What were the secondary endpoints, and what were the results?
There are a few important secondary endpoints, most notably at 1, 2, and 3 months, that I'd like to highlight. Let's start with the 1-month results. At only 1 month, clinicians reported patients treated with Cequa experienced a reduction in corneal staining. The mild fluorescein staining visible before Cequa therapy is visibly clearer at 1 month. There were further visible clinical improvements at 2 and 3 month time points. At 2 months, we found that Cequa patients showed significant improvement in total conjunctival staining. The moderate lissamine green conjunctival staining visible before Cequa is much milder post-Cequa therapy. As well as at 2 months, Cequa showed significant improvement in conjunctival staining at the 3-month time point. 65% of central corneas were also completely clear. Patients also experienced a notable improvement in tear production at 3 months. It is important to highlight that at day 28, clinically significant improvements were seen in the Cequa group when compared to the vehicle group.
Are there any other notable side effects from the clinical studies? If so, how significant were they?
Yes, during the clinical studies, we found that 22% of patients reported mild or moderate instillation site pain, with the majority of those patients reporting mild site pain and the remaining 3.6% reporting moderate site pain. Overall, over 95% of patients experienced no or mild instillation site pain.
As a notable speaker for Cequa, what most impressed you of the clinical findings for Cequa?
What most impressed me from the clinical findings of Cequa is the central corneal clearing. This is a very powerful statement, and because I'm always trying to optimize vision for my patients, if a patient has central keratosis, they won't be seeing as clearly as they could. So it's very powerful for me to be able to lean on research that shows that central corneal clearing or total corneal clearing can be provided from Cequa.
Dr. Odell, why would you prescribe Cequa to your patients over other cyclosporine treatments?
I reach for Cequa because it has better penetration into the ocular tissues, and that will improve the anti-inflammatory effects that I'm looking for in a much timelier fashion.
So how has Cequa helped your patients?
For really addressing dry eye, most of the time I would say Cequa is transformative for patients because they haven't had comfort or days where they don't think about their eyes until their dry eye symptoms are addressed. My experience with Cequa has really been overwhelmingly positive for patients and what I'm seeing clinically. And I think that really speaks to the way the medication is penetrating into the ocular tissues to give that anti-inflammatory effect that I'm seeking when I'm treating these patients. So I really see what I am looking for when I'm treating patients with increased Schirmer production, so increased tear production for patients, and also just improvement in corneal and conjunctival health that gets me to my treatment goals for my patients.
And lastly, how accessible is Cequa for your patients?
Sun has done a tremendous job of bringing a medication to the market and making it accessible for patients. I feel there have never been barriers to me prescribing the medication, and I really applaud Sun for that because they have figured out a way of making medications accessible to the market successfully.
Visit cequapro.com and request a representative to learn more about Cequa.